Aging is inevitable, but it wouldn't be so bad were it not for the sagging, wrinkles, and folds that go along with it. Generally, the first areas to show aging and fatigue are the eyes. You can use creams, certain lasers, and even Botox to paralyze muscles, but eventually these too have their limitations. Let me show you. In the end, a lower eye lift or blepharoplasty is by far the most effective way to rejuvenate and smooth out the lower eyelid. Patients that come to me for lower eyelid surgery want an exceedingly natural result with, of course, no change in their eye shape. For me to achieve this, a number of steps have to be performed. I first remove any protruding eye bags and then fill the tear troughs with fat, which are just these dark circles that are located just below the fat bags. And I do so in order to reestablish a smooth transition from the lower lid into the cheek. I do this with the patient's own natural fat, which I gently harvest and purify before transferring it. Finally, I remove any excess skin and wrinkles, leaving an imperceptible scar at the eyelash line. By way of example, after having just transferred fat into this patient's dark circles, I then precisely excise excess skin and finally close the incision with one stitch, which gets removed in 5 days. Removing excess skin requires extreme finesse because an extra 0.5 millimeter could spell a problem. Every single one of the hundreds of blepharoplasties I perform each year requires an obsessive attention to detail in order to produce an artistically natural result. But, unlike the art hung in a museum, good plastic surgery is invisible.